So with a lot of this coronavirus stuff going around, I'd like to give some input on what I think should be done and why we should be doing what I think we should be doing. um, as of today, May 7th, 2020, there are 1.28 million confirmed cases in the United States of COVID-19, and there are about 75,991 deaths that are associated with COVID-19 in the US. So doing the math just by simple division, that would give us a 5.9% death rate, which isn't terrible, but isn't actually very great either. But if you really look into it, the death rate is a lot lower than what we would actually think. For evidence for this lower death rate, or lower rate of people who get corona getting sick from it and like actually experiencing symptoms and being put at risk for death, I'd like to bring up the Marion Correctional Institution. This is a prison in Ohio that had a coronavirus outbreak. It has about 2,500 prisoners, and many of them are older with pre-existing health conditions. So it could look a lot like our US population demographic, with an aging population, with all the boomers. Nah, just playing. After testing 2,300 inmates, 2,028 of them tested positive for COVID-19. But surprisingly, 95% of those who tested positive for COVID-19 showed no symptoms. And just so you don't think this is like a one-time occurrence, it's also occurred in the 4 state prison systems of Arkansas, North Carolina, Ohio, and Virginia. 96% of the total of 3,277 prisoners who tested positive for coronavirus show no symptoms. Doctors across the country agree that our national count is actually a horrid underestimate of how many people have actually had corona in the United States. So just taking this into account, let's just say 100% of Americans got corona, right? The US population is 328 million people. If every single person were to be infected, according to that 96% thing of no symptoms, only about 13,120,000 people would experience symptoms of corona. Assuming a 5.9% death rate, about 775,000 people would die, or assuming like a 2% death rate, which can be accurate, which I will get on to later in the video, about 262,000 people would die from corona, like that had symptoms. I just want to mention that with the death rate of either 5 or 2% or 5.9, I'm only applying that to the people who have symptoms because that is how our death rate is currently working in the United States, because you have to have symptoms to get tested for corona. But what's important to understand as well is that the entire US population is not going to get coronavirus. No matter how hard the government wants, or the Chinese want, or anyone wants, not every single person in the United States is going to get coronavirus. It's just not, it's not feasible, it does not make sense, and that would be the absolute worst case scenario. But we've already implemented social distancing for a while, so we should be pretty good. Also, let's just say only 3/4 of the population got infected with coronavirus, right? 3 out of every 4 Americans getting coronavirus still seems a little high to me personally, but let's just roll with it. Let's say that many people get coronavirus. That would mean 9.8 million people would show symptoms of corona. And assuming a 5.9% death rate, that would lead to about 580,000 deaths. Assuming a 2% death rate, about 200,000 people would die from corona. So, I mean, obviously that is a lot of people, and we do want to prevent lives from being taken by this virus. But in the grand scheme of things, there are already 75,000 deaths. So evidently this pandemic that is so dangerous that everyone needs to be wearing masks in public at all times is not as big of a deal as we once thought. Also, I would like to bring up the laboratory confirmed COVID-19 associated hospitalizations for the week ending April 25th, 2020. The rate per 100,000 people like hospitalized for coronavirus symptoms for ages 5 to 17 is about 0.7, which would give me a 0.0007% chance of going to the hospital because of coronavirus. That's a pretty low percent to shut down the entire nation for. I'm not advocating that we just let everyone go out, but there may have to be some measures put in place to protect those with pre-existing health conditions, which brings me to my next point. During March 1st to 30th, 89.3% of those hospitalized for corona had at least one pre-existing condition. And those top 5 conditions were hypertension, obesity, chronic lung disease, diabetes mellitus, and cardiovascular disease. I apologize if I pronounced the diabetes thing wrong. I'm not very familiar. So basically what I'm saying is, let's get people with pre-existing conditions to quarantine until everyone else who has a much lower risk of getting coronavirus or getting symptoms from coronavirus in the first place, or even being sent to the hospital. Let's have all the young people go out instead and develop a herd immunity. Basically, let's isolate those with pre-existing health conditions for their own safety, and maybe the elderly. I'm not 100% sure because the data doesn't really show whether the elderly are just more likely to get it because they're old or because they have more pre-existing health conditions. Like, there's not enough data to completely determine what the reason is for old people getting coronavirus and it being more deadly. So yeah. Now, I just want to end this video by saying I am not a disease expert in any way, and I can't 100% guarantee the outcome of the coronavirus, but as a 17-year-old kid, and I'm being able to see that this virus is not as big of a threat as everyone else is making it out to be, I think that our government should be capable of reopening the economy with some sort of preventative measures in place. So I'll leave you with some food for thought, and have a great day.